United Nations will host the first ever UN General Assembly high-level meeting on TB this September, which is aimed at compiling a political declaration on the disease. South Africa, as you heard, one of the countries with the highest burden of TB, and it continues to be a leading cause of death. Historically, the Eastern Cape, KwaZulu-Natal and the Western Cape have had the highest incident rates. In 2015, the World Health Organization estimated that just under 1%, 0.8% of the population had an active infection. That's 450,000 people. Well, to discuss, we're joined by Dr. Norbert Ndjeka from the Department of Health. Thank you for being with us. Doctor, you heard there that some of the later stats from about 2 years ago. What's the state of TB in South Africa right now?
Thank you so much for inviting me, and thank you to the viewers. The state of tuberculosis is not really good news for our country. We know that there have been a lesser number of drug-susceptible tuberculosis initiated on treatment. That is approximately 300,000 cases per year, but we know that 130,000 approximately are being missed, and we get around 12,000 MDR-TB every year. That is approximately 10% of patients on MDR-TB in any program globally. So we are a high-burden country, and then we need to continue to put our effort in fighting this disease.
Okay, so explain what the cure rate is, because like the Deputy President was saying today, this is a curable disease. So if people do take the drugs as required, it's over a long period, they want to fix that. But what is the actual cure rate?
Yeah, the cure rate for drug-susceptible TB or ordinary tuberculosis has gone just above 80%. We should reach 85%. We're nearly there. In terms of MDR-TB, multi-drug-resistant tuberculosis, the cure rate for our cohort, the last one that we reported was 2014, which was 54%. So we believe that we almost reached our target of 55% for MDR-TB. Now, in terms of extensively drug-resistant tuberculosis, those are very sick. We see lesser than that, but that's the one area where the cure rate is improving faster.
Okay, so the problem is that people are resistant to the drugs, and how are we addressing that? Yeah,
the issue of resistance is being addressed in many ways. Of course, you will know that to treat is to prevent. It starts there, but then also primary prevention is critical. We are improving infection control at our health facilities, and we also multiplying efforts to find the people with the missing cases. There are a lot of people who have tuberculosis and they do not know, or they are not on treatment. So those are to be found, and their effort to find them and bring them, link them to treatment alongside your ordinary infection control measures.
The Treatment Action Campaign, looking at infection controls, said they visited clinics. Of the 207 clinics that they assessed around the country, 145 were in a red state, meaning there were poor infection controls, meaning people go to clinics and get sick. So I hear the ads, we're telling people what to do, but on the other hand, is government allowing people to go to places of health and they're getting sick?
Yeah, I agree. In a long time, our strategy has been focusing more on providing treatment, tablets, injections, and all that. But there are efforts now towards primary prevention. But the problem of preventing tuberculosis is not just a medical problem. It requires the entire nation to come, you know, to the party, because one key area is, for example, the infrastructure. How do we build our clinics? How do we build any building in the country? It is very important to have the prevention of tuberculosis in mind, but also public transportation, what happens there. So the problem is bigger than just going to a healthcare facilities. It has to be you know, addressed by all you know, sectors of society.
But surely that's where you start, the clinics where TB patients are going to.
Definitely, there got to be effort to start there, and it is happening. It's just that it's a bigger problem which requires a lot of resources. It requires a new way of life, but we're getting there. You know, the message is filtering down, maybe slowly, but we're moving in the right direction.
Reports that traditional healers, a lot of people go to traditional healers for help. There are attempts by the health department to get them on board and send people to clinics. Tell me about that.
Yes, the theme for this year's World TB celebration is wanted leaders to end TB. So this is a call to traditional leadership, but all leadership, including the healers, because we know that our patients start, you know, outside conventional health facilities. So the event today in Durban was really to call upon everybody, all leaders, be it business leaders, traditional healers, traditional leaders, so that they could help us in the fight against tuberculosis. Like I said earlier on, this fight requires all leaders within the society, not just healthcare leaders.
And finally, Doctor, what's your advice to South Africans? You've spoken about the problems, people not taking the drugs, they need to do that. That's people who know they have TB. But you've also spoken about the many thousands, hundreds of thousands walking around with TB. How do you protect yourself?
How do you protect yourself? Thank you. That's really a very important question. If anyone is coughing, they could be having tuberculosis. They should check with their clinics. They should get checked at a clinic to rule out tuberculosis. If they found to have tuberculosis, this is a curable disease. Be it ordinary tuberculosis or drug-resistant tuberculosis. We do have new medicines, like the minister was saying earlier on, and all these are helping us really to treat people more efficiently, and we're getting better results day by day.
All right, thank you very much, Dr. Norbert Ndjeka from the Department of Health. We take